Hello everybody, welcome once again to your Saturday online clinic. My name is Regina Askia Williams and I'm reaching you from New York City. It's always a pleasure to be with you, okay? Today we're all about men's health, all right? And this is going to be talking about the social, mental, and physical aspect of the man's health, okay? The men are notorious for refusing to go to the doctor, and this is sad because most of the conditions that affect the men can be taken care of, can be treated if only they are found on time. Why they do this, we don't know. So it falls down on the women in their lives to make sure that they take their men to the doctor at least once every year for a complete physical and wellness check, okay? This is your Saturday online clinic, and we welcome everybody reaching us from Africa, from Australia, from London. When you're making your comments, be sure to tell us where you are watching from. We're always happy to have you. If you want to be a part of this conversation, we can beam you in right there. Indicate, and my cameraman will send you an invite to join us, okay? And remember to wear your headphones when you're asking your question, so that we do not have the problem, the audio resonance problem we had the last time we forgot to take our headphones off. And after your question, please disconnect so that other people will have a chance to come on and ask their questions or make their comments, all right? This program is sponsored by African Views, and it is supported by Campaign for Nurse Excellence in Nigeria and Regina Askia Foundation. All right, it's always a pleasure to be with you. So now let's just jump into the topic of our discussion today. When you go to the doctor, the first thing we're going to do will be give you a physical assessment. All right. After we talk about the physical assessment, we're going to talk about your social history, and we're going to talk about conditions that affect the man's reproductive health, all right? So let's start from the physical assessment, all right? Your physical assessment has to do with checking that everything is ticking well from head to toe. We'll start with your blood pressure. Your blood pressure gives us an on-the-spot assessment of how healthy your heart is, and if your heart is healthy, we can say that most of your body systems would be healthy. Now, if your blood pressure is high, that is a cause for concern, because we're going to have to figure out why is it high. Is it because a high blood pressure means that your heart is working overtime or exerting too much pressure to pump blood around your body? Why is that happening? Is it because there's a lot of fat plaques deposited in the blood vessels, or is it because you have diabetes that is affecting the overall vascular health of your system? We are going to check your blood pressure. We're going to check your height and weight and take your BMI, because that gives us an idea of the total fat content in your system, all right? We will measure your waist circumference because we're looking for truncal obesity. Truncal obesity is a risk factor for many diseases or the conditions that affect the man. Your heart health, your your diabetes profile, your lipid profile, truncal obesity affects all that. It also predisposes you to what we call metabolic syndrome, which means that you have the double whammy of hyperlipidemia, high blood sugar, and hypertension. We will check that, and we will put you on a special diet program and exercise program to take care of that situation, okay? We'll also test your urine to make sure that there is no blood in your urine when you have high blood pressure, because the blood vessels supplying your kidney when you have high blood pressure tend to be compromised, and blood will leak into your urine. So we check your urine to make sure that there's no blood in there, and if there is, we're going to recommend that we do a sonogram of the kidney to make sure that the kidney is okay, all right? After this, let me touch a little bit on diet and exercise. We keep talking about diet and exercise and leave people confused about what exactly they are to do. Diet, the one thing that you cannot go wrong with is eat closer to the ground, like Dr. Luya had once said. Make your foods not processed. Cook your foods, okay? Eat more vegetables, more high fiber diets, so that you do not have surges of blood sugar in your system from processed foods. And lightly cook your diet, and most importantly, portion control. Africans have a good diet base, but they eat like mountains of fufu and eba, and this is not good for your system, because all the excess energy from this is going to be turned into fat and deposited in your causing truncal obesity, or deposited in your blood vessels, and you don't want that. Now, exercising. A lot of talk has been said about exercising. If you try to be as active as possible, this is a good thing. You can swim, you can bike, you can walk, you can run, you can hike. Just be active, okay? And in between the days you do these things, try to do weightlifting to tone your muscles, right? Yoga is another very simple way to take care of your muscle tone, okay? Now, after we check you from head to toe, make sure that the eyes are seeing good, that there's no swelling in the mouth, or no rotting teeth, or no compromising of the esophagus, and check that your thyroid is not swollen, check that your heart is beating well, no murmurs, that your lung sounds are clear, that your stomach is functioning, right stomach sounds are present, and that your bowel movements are, as expected, that your skin is in order, you do not have any moles that are changing in color or spreading or getting macerated, and that you're able to walk and there is absence of pain. When we make sure that all that is together, we will now go into recommended screening for a man, the way it's been recommended for your age group, okay? Some of the screenings we do are going to go into it in depth. Do I have any questions? No. Some of the screening we do, first of all, will be the cholesterol test. The cholesterol test measures the overall fat content in your system, right? It's called the lipid level test, all right? Now, the lipid level test shows us the amount of lipids in your system. We have a recommended level here, and we have 4 types of lipids in your system. We have the low density lipids. This is the bad type of fat that gets deposited in your blood vessels. Then we have the high density lipids. This is the good cholesterol that actually keeps the arteries free of plaques. And then we have the triglycerides. This gives your body energy. And then we have the measure of the total fat content in your system, okay? Now, it's been recommended that the bad cholesterol should be less than 70 if you have other comorbidities, but between 100 to 129 if you're healthy, okay? The high density lipoproteins should be between 40 to 59, and the triglycerides, or the total body fat content, should be less than 200 milligrams per deciliter of your blood, all right? It is very important. Why is it very important? Because the cholesterol content deposited, the fat deposited in your blood vessels have been causative factors for strokes, okay? And high blood pressure and all the rest. Another screening we would do with you is a blood sugar check, okay? Blood sugar levels are very important because the condition of diabetes wreaks havoc on your blood vessels. When blood is not supplied to different body parts as necessary, we will find that those body parts start to deteriorate. Like in people with diabetes, you have poor blood circulation to the lower extremities. We start noticing that wounds are not healing, we have infection, and then we have a situation where limbs have to be cut off because of poor circulation to the areas. So we do this screening to make sure that your blood sugar is under good control. Okay. Another thing that is very important for men to check out will be colorectal health. Colorectal health makes sure that you are in a good position to keep colon cancer away. Colon cancer is a very slow growing cancer. It could be caught on time, but since men don't go to the hospital or do their regular doctor's visits as often as ideal, when we find colon cancer in men, it's often in the late stages, and mostly African American men don't tend to do well with colorectal cancer. So it is recommended that after the age of 50, you schedule yourself for a colonoscopy check, okay? So the check will find polyps or growths in your colon, and if they find it, they'll do a biopsy to make sure that it is not a cancerous polyp, okay? Now, do not wait until you find distressing symptoms of colorectal condition before you go in to take care of yourself. Symptoms like fatigue, weight loss, stomach pain, changes in bowel habits. Where you used to have formed stool of a good size, you now have skinny pencil stools. It's time to have your doctor check that out, because it might be a growth in your colon that is causing a narrowing, making that stool formed that way. Bloating and cramping are all symptoms of possible colorectal cancer. Now, these symptoms could be found in, different other conditions could bring on these symptoms. So the only way to really make sure that it is not a situation of colorectal cancer is to have your colonoscopy done, okay? We talked about skin health to make sure that moles are not turning cancerous. We'd like to remind you that just because you have melanin protecting your skin does not mean that you do not need protection from the sun. It is very important to use sunscreen when you're going to be out in the sun for long periods of time. We often talk about alcohol, depression, and drug use. We also screen for that. Alcohol, people say, oh man, a man has to drink. Yes, you have to drink, but in moderation is important, because alcohol influences your choices. You don't make good choices when you are boozed out, and also it is a depressant. It works on your central nervous system negatively, and it affects your liver health, it affects your kidney health. So be careful with excess alcohol. Drug use, okay, it never brought on any good results. Drug use, especially needle injection, can lead to infection of the site of injections. Also, it could lead to transmission of hepatitis, like we discussed the other day, and we need to be able to cut that out of our everyday lives. Okay, we will screen for eye, ear, and hearing and make sure all that is working right. And finally, we would ask you about your immunizations. Okay, are your immunizations up to date? And recommend that you take your flu shots every year. And at the age of 65 up, remember to take your pneumonia shot as well. Okay, now having said all this, we have come to the point where we would like to talk about the man's reproductive health. Okay, and we will focus on the various conditions that impact on the male reproductive health. Okay, cameraman, do I have any questions? Do I have any comments? All right, so please send in your comments and send in your questions. Okay, the biggest thing I'm going to talk about in the man's reproductive health is prostate cancer. All right, prostate conditions that affect the man's reproductive health. All right. Okay. Now, yes, I saw that hand.
Miss Victoria said, what's your profession now?
I am a nurse practitioner, and I do a lot of community service by sharing information on your healthcare process. Okay, we break down your healthcare situation in simple terms that you can understand and arm you with questions to share with your doctor. All right, thank you, Victoria. Okay, so when men get older, they have a lot of complaints like the ones I have here, all right? A lot of men say they are finding it difficult to start, urinating, okay? They're finding it difficult to fully empty their bladder. They're finding a weak dribble or a weak stream of urine. They complain of a loss in small amounts of urine during the day. Some of them say that they have an inability to feel when the bladder is full, and they feel increased abdominal pressure, okay? They lack the urge to urinate. They have to strain to push out the urine, okay? And then they suffer frequent urination and find themselves waking up many times at night to go pee, all right? So, all these symptoms are symptoms of urinary retention, but what is causing the urinary retention, okay? Men have a small organ at the base of the penis that is called the prostrate gland. The function of the prostrate gland is to provide lubrication or provide is to bathe the semen produced with liquid, seminal fluid, okay? This liquid protects the sperm, and it also provides the medium for them to swim in, okay? Now, it also provides the liquid that is present when the man ejaculates, okay? So the prostrate and the seminal vesicles together provide this fluid, okay? Now, when the prostrate enlarges, okay, sometimes it is a benign enlargement, sometimes it is a cancerous enlargement. But when the prostrate enlarges, we find that it kind of blocks the duct through which urine and this fluid is eliminated from the body. So when urine flow is hampered, all these symptoms are experienced by the man. So when you go to your doctor complaining of these symptoms, they're going to do two things. They're going to do a digital rectal exam or a PSA test, a blood test that shows the amount of prostate antigens in your blood, okay? Now, when they do a digital rectal exam, which means that they will, with a gloved, lubricated finger, go through the anus and feel for the prostate, they're going to note that the prostate is not hard and immovable, okay? If the prostate is hard, immovable, and enlarged, that is cause for concern. If the prostate is just enlarged but soft to touch, that means that is indicative of a benign prostate situation. But when it is hard and enlarged, it is cause for concern. Further tests will have to be done to ensure that it is not prostate cancer, okay? Now, further tests like biopsy, they'll take a little bit of tissue from the prostate and make sure that there is no cancer present in that, okay? If it is a benign condition, you'll be put on medications that will help shrink the prostate or will help relax the musculature of the area to restore a good passage for flow of urine. Now, why is urinary retention not a good thing? It's not a good thing because when urine sits, it is a good breeding ground for bacteria. When we have urinary retention, the next thing we're going to be looking at is a UTI, a urinary tract infection, and we do not want that to happen. All right. Now, when the blood test reveals that you have prostate antibodies that are affecting your prostate size, you'll also get medications to help control that. Okay. It is not recommended that aggressive treatment be done to the prostate, especially if it's just a benign prostate situation. You will go on medication and it will help shrink the prostate size. When men get older, 1 in 3 men after the age of 80 have prostate cancer, autopsy shows. So it is somewhat expected, when you get older. This is why aggressive treatment is not recommended, because the benefits do not outweigh the risk. Aggressive treatment of prostate cancer, when it has been established that there's presence of prostate cancer, aggressive treatment of that is very necessary. Okay. Now let me say something about medications, benign prostate hyperplasia medications. Men who have erectile dysfunction, a level of erectile dysfunction, and take Viagra to help that situation, should be very careful of taking Viagra with medications that help the prostate, or taking Viagra with high blood pressure medications, because high blood pressure medications work by relaxing the walls of your blood vessels. Viagra also works by relaxing the tone of your blood vessels. If you take them together, you have a situation of extreme hypotension, and you don't want that to happen. Okay? All right. Another condition that impacts men's reproductive health is testicular cancer. Testicular cancer is found in the testes, the 2 bags that are found at the site of the penis. Those 2 bags house the testicles. The testicles is what affects the production of testosterone. Testosterone is a male hormone that helps the development of male characteristics, muscle tone, reproductive organs in the male body, and all that. It is very important to ensure that your testicular health is together, because it impacts many things in your system. It impacts your brains, like this chart shows, because the levels of testosterone impact your sex drive, okay? Improve mood, confidence, and memory function, okay? It also impacts your muscle growth, increased endurance, and increased strength. It impacts your bones because it impacts the bone mass density. It impacts the development of the sex organs and even the health of your prostate, okay? It impacts your bone marrow. Remember, your bone marrow helps make your blood, and it also impacts your skin, okay? It promotes hair growth and collagen growth. So if you have testicular cancer and the production of testosterone is impacted, and we're going to be seeing all this in the negative ends, and we don't want that. How do you check to make sure that you do not have testicular cancer? It is recommended that men in the shower feel the testis, okay? Hold it firmly and feel around for lumps. Now, your epididymis is different because you may feel like a bag of worms. That's a different condition. Now, feel for lumps. If you feel lumps in your testis, you need to report that to your doctor, so that your doctor performs checks to make sure that this is not a case of testicular cancer, okay? All right, it is normal for one testicle to drop lower than the other. Don't be alarmed by that, okay? We do not want a condition of low testosterone, so we must maintain testicular health. The reason why your testicles are dropped from your body is principally for thermal regulation. It doesn't help for them to be in a condition that's too hot, okay? So you find that they drop to allow cooling of the testicles to promote testicular health, all right? There is another condition that affects the male reproductive system that is called Peyronie's disease. The street parlance for that is a curved penile shaft. Most men are embarrassed to talk about this, but a curved penile shaft or curvature of the penis happens when the penis is healing from an injury and plaque, gathers from scar tissue. Where the scar tissue is positioned causes a shortening of the muscle system of that area. And so we see a situation where when the penis is healing, it heals towards that area. If the scar tissue is found on top of the penis, if the injury was on top of the penis, on the upper area, and there's healing, the penis will curve up. If it was to the side, the penis will curve to the side. Now, if this is not hurting, then there's no need to do something about it. But if it is an extreme curvature that affects your performance, your sexual performance, you might want to talk to your urologist about this condition, because there are different ways to take care of it, okay? Now, there is testicular torsion, where the blood vessels supplying the testicles are all twisted and tied up. This is an emergent situation. You have to go to the ER immediately. It presents with pain and swelling and accompanied with nausea. You have to go to the ER immediately, because if there is prolonged cut off of blood supply to your testicles, the tissue starts to die, and we do not want that. There is also hydrocele. Hydrocele mostly is found in infants, so I'm not going to spend a lot of time on that. Okay, the doctors take care of that one. We have balanitis or balanitis, or however you pronounce it. This is when there is an irritation on the head of the penis, mostly due to poor hygiene. We find a skin breakdown or a rash, or this is mostly found in people who are not circumcised. If you pull back the head of the penis or the skin, the foreskin that is covering the penis, you find maybe skin breakdown or rashes around the head of the penis. Now, washing it with soap and water, coconut oil, and things like that can help take care of that situation. But if it is extreme, your doctor may prescribe medication, usually topical medication, to use around it. If you don't take care of the situation, the skin there might try to heal and contract, leading to a situation called phimosis. Phimosis is when the foreskin contracts and tightens, so much so that it constricts the head of the penis. You don't want that to happen. So this is another situation you should discuss with your urologist and get treatment for, all right? We also have priapism. A lot of people who have sickle cells often experience priapism because the malformed blood cells get trapped in the blood vessels that supply the penis, causing the penis to stay erect for long periods of time. This is dangerous, especially because there is interruption of blood supply again to the organ. You need to go to the hospital and have the doctor restore blood flow to the organ by clearing up that blood vessel. Okay, priapism is a dangerous situation for men, and you're not encouraged to try to manage it by yourself. You should go and have the doctor take care of that. All right. Another condition we find in men is inguinal hernia. A hernia happens when when your intestines are able to slip through weak muscles, okay, and form like a bump in your femoral area, okay. Sometimes when it is not very serious, we are able to push it back in and use a mesh to take care of it, okay. But it is a condition that your doctor should work on because it gets progressively worse, all right. You don't want to have your intestine hang out of your abdomen. Sometimes it drops into the testicle area, and we have a testicle that is so swollen, or a scrotal sac that is really swollen. We've seen ones as big as a head, and we have to support it on a pillow and try to push the intestines back and secure the area with a mesh and restore the organs to where they are placed. Do I have questions? Okay. All right. Now, if that is not done, we find a situation of strangulated hernia. We don't want that. Strangulated hernia is when the intestine gets stuck, okay? It gets stuck, the muscles strangulate blood supply to it, and then we have a problem, okay? Now, the biggest concern for most men when we're talking about men's health is erectile dysfunction, all right? What do we mean by erectile dysfunction? Erectile dysfunction is usually an inability to get an erection or maintain an erection, so much so that a man is unable to perform sexually, and this leads to a lot of frustration, okay, on the part of the man. Let me talk about this. This is glenitis. It leads to phimosis, okay, if not cured. This is phimosis, when the penile head gets incarcerated by the healing foreskin around the penis, okay. This is how a normal penis should be, and this is the condition of phimosis, okay. Foreskin of the penis cannot be pulled back, okay. The treatment for that is circumcision. Take care of that. Just remove the foreskin, okay. These are the symptoms of urinary retention we talked about, okay. Now, this is a penis with Peyronie's disease. You see, there was injury here, and the scar tissue and the plaque formed on top of the penile shaft, and so with an erection, the penis tends to curve upwards, all right? Okay. Here we have symptoms of erectile dysfunction, and those include premature ejaculation. When you have premature ejaculation, your urologist can help you take care of that. It is nothing to be ashamed of. I read somewhere on the Nigerian blogs of a 4-minute man or 3-minute man. It is nothing to be ashamed of. Discuss it with your urologist. There are ways to take care of that situation, okay? Premature ejaculation, reduced sex drive. This is where we're going to check your levels of testosterone and make sure that everything is okay. See, low testosterone levels will lead to a reduced sex drive and an inability to achieve or maintain an erection. Now, these symptoms of erectile dysfunction may be for a variety of reasons, which should be investigated by your urologist. I keep saying your doctor, your doctor, your doctor. Okay, don't try to manage these situations by yourself. You get whatever information you can get from us and share with your doctor, and he fashions out a plan of care that is suitable for your diagnosis, okay? Erectile dysfunction, the inability to keep or maintain an erection, mostly is because there is a hindrance of blood supply to the penile shaft. Why is that happening? Do you have high blood pressure? Are you taking high blood pressure medications that are impacting on your blood supply? Are you worried about something that is making your brain and sex system unable to coordinate? All right, I have a question. 1 second. Yes. Yes.
What are the natural foods that help boost sperm count and maintain erections?
Okay, I did read something about that, but I'm kind of reticent to give you the list of that. I will find you and I'll share with you that information because it is important to me that you coordinate your care with your doctor. Okay? Yes, thank you. Yeah.
Maria says, what about prostectomy?
Prostectomy. Okay, to remove your prostrate. Okay, sometimes if there is cancer, the prostrate will have to be removed. But like I said, if it's a benign prostrate condition, it is best to leave it alone and medically manage it so you do not affect the sexual performance of the man. Like we're talking about erectile dysfunction. There is a lot of nerves there, and in going in to mess with the prostrate, you might end up causing more damage than good. Okay, so if there is no complaint of if there is no cancer and there is no danger of mets, it is better to medically manage the prostrate. Okay, all right. So we were talking about, are we done with the questions? Yes. So we were talking about blood supply to the penile shaft. Okay, we have to make sure that you're not on medications that are causing you not to be able to have an erection. We have to make sure that you do not have conditions like diabetes. Diabetes really wreak havoc on your blood vessels and impact your the blood flow to your penile shaft as well. Okay, so now when you take care of situations that impede blood flow, you also have to take care of your mental situations, because if you're feeling low self-esteem, performance anxiety, you are depressed, you have a lot of things going on your mind. Most men find that they're not able to perform sexually when they have a lot of things on their mind. So for that, I would recommend, if you suffer depression or a variety of mental conditions, you should have your doctor, your mental health doctor, check that out and put you on necessary medications. But if it's just high anxiety, everyday anxiety, and you could do things like meditation and yoga to calm your mind and get you in tune with the work you have at hand, so to speak. Okay? All right. There are also medications that help manage erectile dysfunction. Top of the list is Viagra. Okay, like we said before, if you have high blood pressure and you're taking high blood pressure medications and you want to take Viagra, you have to be very careful. You never take the two together, especially if your blood pressure medications are the ones that work by relaxing your blood vessels. You have to be very careful that you don't end up with critical hypotensive condition where we find you passed out or all that. Okay, so take care of your mind, take care of your vasculature, take care of your hormone panel. Make sure that your testosterone levels are up to recommended standards so that you'll be able to perform properly. Okay, with that being said, I will leave you with this. Okay, if you eat right and stay within the correct weight, okay, recommended weight parameters, and control your blood pressure, control your blood sugar, and make sure that your vascular health is up to par, you will be in a good situation when it comes to men's health. Okay, also be quick to report symptoms of your urinary retention to your urologist and take care of that, because last thing you want is to end up with a UTI, okay, a urinary tract infection. Okay, check for sexually transmitted diseases. I can't stress that enough. Check for sexually transmitted diseases. Every time you go for a doctor's checkup, my dog is bothering for attention. Every time you go for a doctor's checkup, be sure that you get checked for gonorrhea, syphilis, chlamydia. Chlamydia is often passed around from, partner to partner. You must check for sexually transmitted diseases because this impacts on your reproductive health. Do I have a question? Yes.
Alan says, what's the recommended weight for a 6'2" guy?
Now, bring out your calculator and go to your go to Google. Ask for check my BMI. Check my BMI. Okay. Your BMI gives you an idea of your total fat, the total fat content on your body. It takes into consideration your height and weight, all right, and then it gives you a recommended weight parameter that is ideal for your height and for your weight, okay? Were you able to do that? Are you calculating a BMI for a 6'?
We need to know his weight.
Oh, okay, we don't know your weight. Put in your weight and put in your height, and you will find it on your BMI calculator. Your BMI means body mass index, okay? It gives the doctor an idea of your total fat content, and then he puts you on a diet. He also recommends exercise routines that will help you, okay? Another question?
Mohammed wants to know when you're going to be talking about C-sections.
Oh, we'll be talking about C-sections. I could bring Dr. Syed back if that is popular demand to talk about C-sections, okay? And we'll take it from there. A lot of people are scared of C-sections, but it is nothing to be afraid of. We will shed more light on that situation as time comes on, okay? Yeah, the questions are pouring in. All right, next question.
Alan said that his weight is 222 pounds.
Okay, 222 pounds, and he's a 6'.
6 feet and 2 inches.
Okay.
So Google is telling me that it's 28.5 overweight BMI.
Oh, 28.5. That is overweight, but when your BMI goes beyond 30, that means you are definitely approaching obesity, and you have to really take yourself in hand and do something about it. Now at 28, you likely overweight. You would do well to control your diet, like we said, eat natural foods and exercise. Yoga, muscle training, and cardio would work for you, okay? All right.
Sarah wants to know when you're going to be talking about the female reproductive system.
We did talk about the female reproductive system with Dr. Syed, and I'll make available that video with high points because she did discuss the female reproductive system and what to look out for at various points in your life. She talked about when the female was in her 20s, in her 30s, 40s, and 50s, and there on. So I will make that video available to you, okay? All right. More questions? Okay.
Yusuf says that he's 85 kilograms and 1.7 meters?
Yes, 1.7 meters. Be careful because there's kilograms. Your BMI can be calculated in kilograms, or like in America, we use the pound system. So when you enter your BMI when you enter your height and weight in your BMI calculator, which is present on your phone, be careful if it's kilograms you're entering or if it's pounds you're entering, okay? All right. But just remember that your BMI should not be more than 30. If your BMI is more than 30, you really should have to do something about your weight, okay? Yes.
I'm not going to try to pronounce his name because I really don't want
to.
All right,
don't pronounce it. Okay.
But he says that he's tall. He's about 6'7". He noticed that the last 3 months he had very slow libido. Mm-hmm. It nearly crashed his family, but he said that he started taking some drugs not recommended. He says that he's well now, but he wants to know how to prevent it in the future. He says it's bad, and he says that he weighs about 158 kilograms.
Now, what type of drugs were you taking? Were these drugs recommended by your doctor? Were they just supplements? You have to be careful with that because you don't want to, add more problems to what you already have. Now, if you suffer from low libido, the first thing that comes to my mind is your level of testosterone. Did you have a hormone panel done to check your testosterone level? You need to check that out. And also, there are a variety of foods that I'll make available that will help raise your testosterone levels, and just make sure that you do not have high blood pressure or a comorbidity of diabetes, because all this affects your blood vessels, and you need to get those in optimal functioning optimally. Also get your testosterone level checked, and then okay, we'll take it from there. All right, another question.
Another question, comment.
Yeah.
Cynthia wants you to know that you're doing a great job, sister.
Thank you, Cynthia. Thank you.
Alan says, what's the color and quality of healthy semen?
Color and quality of healthy semen. You know, this is not something I see a lot, but your urologist will be able to tell you that, because depending on your body types and body function, you know, it might be a little opaque, a little milky, a little, you know, it's different for different people, and it's affected also by your diet. You know, what you eat will cause differences in this consistency, and genetically also it might be different consistencies and different amounts. Something that we forgot to talk about that men should check for is low sperm count. Okay, drinking and smoking, all right, are the two major culprits that contribute to low sperm count. So when you visit your urologist, one of the tests you should have done will be a sperm count test, because below a certain level of sperm count, you are not going to be able to get a woman pregnant if that was your aim. And you need to make sure that you're eating the foods that will help keep your sperm healthy and keep them in a recommended, you know, amount of count. Yes, another question.
Miss Denise wants to know if lemon affects fertility in any way.
Lemon, oh, you know, there was something trending on the internet about people drinking Crest, you know, Crest or lemonade to help prevent pregnancies or something. I don't think there's any scientific basis to that. If you are ovulating and then you have semen deposited in your system, you are gonna get pregnant. If you do not want to get pregnant, put yourself on birth control. Now, if the man does not want to get a woman pregnant, condoms are a good option to use. Not only do condoms prevent pregnancies, they prevent transmission of diseases, okay? So your condom, always use your condom. Crest is not a birth control agent, okay? All right, so don't try it. Use your condom and all that. Do we have something else? Do we have another question? I don't recognize that sign. Okay. All right.
Alan begs to know what foods you eat to be healthy.
To be healthy, vegetables, high fiber diet, foods that are natural. Foods that are natural are really, really important. Africans have it, you know, a step above the rest of us because they live in a natural environment and their foods are natural. But what they do is eat too much, okay? Portion control is critical, okay? Because if you eat too much, the rest of it will just be turned to fat in your system. Your vegetables, your afang, your egusi, atama, ogbono, all those things are really healthy. Pawpaw, apples, the fruits we have in Africa. Listen, the best pharmacy is nature's pharmacy, okay? The fruits and the leaves and the vegetables and the roots, these are the things that God made for us to use to nourish our bodies. Stay away from processed foods and high fructose diets. Those will not help you. Yes, another question.
Chioma asks, how do you keep your sperm healthy?
Diet, again, will help keep your sperm healthy. Taking supplements, this is very important. Supplements like vitamins also. Vitamins that contain zinc and the rest of that will help keep your sperm healthy. Chioma is a girl's name. Anyway, I did invite the women to listen in and make sure that they take away nuggets of truths to help take care of their men. So feed him healthy foods. Make sure he gets the supplements. Drag him to the urologist or the doctor at least once a year to give a wellness check head to toe, including reproductive health. Okay, make sure he's healthy. Listen to symptoms he's complaining about, like urinary retention symptoms and all those that we went through. Okay, make sure he's well. All right. Any other questions?
Onochi wants to thank you. Lily says hi.
Hey, Lily. Thank you, Anoche. You're welcome. And on that note, we are going to round up today's discussion. Thank you for participating. Now, if you have a question but were a little embarrassed to ask, inbox me. Our doctors and nurses will go through it and send you a concise answer. Somebody sent me a report of their blood panel, their hepatitis blood panel. And I know you have been waiting for that, for my comments. I am very reluctant to go into that with you because I want you to discuss that with your doctor. If I start telling you do this or do that, that is against the tenets of my profession, because I do not have your blood work in front of me. I have to do other assessments on you before I can make any recommendations or comments on your blood work. Give that to your doctor, and he will fashion out a plan of care for you. I'm sorry about that, okay? So I can only take care of my patients because I have a direct contact and I can stay on top of their progress, okay? If they're doing well, I am able to witness it. If they're doing bad, I am able to reverse it, okay? All right. So on that note, do send in your questions, DM us, and then we will give you insights on what to look out for. We're big with recommendations on what to eat, healthy nutrition, supplements, and the rest of that. But we'll always encourage you to share this information with your doctor, okay? All right. On that note, I'm going to call it a day. Next week, we're going to be talking about mental health. Mental health is very, very important. Mental health is I cannot stress it enough, is very important. And the stigma on mental health we have to do away with, okay? We have to come to terms with the fact that if we do not have a good mental health situation, every other aspects of our lives, of our existence, is going to be impacted negatively, okay? Next week, I'll be discussing mental health with a California-based family nurse practitioner. Her name is Idongesit Stevens. She will be talking with me about the different areas and branches of mental health and how to make sure that we ourselves are healthy, our husbands are healthy, our children are healthy, and our family generally is healthy, okay? On that note, I'll say good night, God bless, and see you next week.